Usually we find the symptoms of the nausea and the constipation and diarrhea and all those typical types of things, gassy, bloaty, those symptoms. They're usually earlier on after surgery, more common with something like the bypass because it is such a big operation and changes in what we're doing, the way things are absorbed in your body. But for all the operations, there's a potential because we're inside there, we're doing things to your body. If you're finding that you're getting sort of looser bowel movements, get a lot of fiber in your diet. So that's like Metamucil, Benefiber, any of those fiber supplements. There's chewy, gummy kind of stuff, whatever you can tolerate, because the fiber will help soak up some of that water and then they won't have as much diarrhea. Some patients are concerned about their skin after the weight loss and the excess skin. And some insurance companies cover the excess skin that hangs over if it's causing, infections and redness underneath because it's hanging over so much, and they will pay for that part of the operation. Not all insurance plans cover it. Some patients with exercise are able to kind of bring it in enough that it's not hanging over, it's not super bothersome to them. And they have so many great clothing devices out there that they're able to hide it really well. So it's really a very personal choice. The excess skin depends on age and genetics and, the elastin in the tissues, and exercising does help, but it's not 100%. Usually if you're already having a lot hanging over, you are going to continue to have that skin hanging over. But some patients, it's mainly just protruding out, and when they lose the weight, it kind of comes back in. It's never tight, but it's enough that it's not really bothersome to them, and so they don't care. This is a issue to think about, but I don't think it's something to completely focus everything on, because the reason why we're doing this operation is to extend years of life and quality of life. So if we're adding 8 to 14 years to someone's life and they're no longer taking a handful of medications every morning for their diabetes, high blood pressure, high cholesterol, and we're preventing that heart attack and stroke that are going to happen down the line, I don't think they care about a little bit of extra skin. What we're finding, and actually the reason why some patients actually come in for weight loss surgery, is the effect that it does have on females' hormones and makes them actually more fertile. So many patients who have difficulty getting pregnant, by losing the weight, they become more fertile. So there is even one more reason why many patients look into weight loss surgery. And because of that, even if you're closer to menopause and you don't think there's any chance you can get pregnant, we warn them very seriously that they need to be on a birth control for the first year at least after surgery, because you don't want, depending on the type of surgery, it's almost 1.5 to 2 years for bypass, but for sleeve and for band, we're looking at least a year and a half. We want you on very strict birth control because we've had 42-year-olds become pregnant and they weren't planning on it. Losing that weight not only makes you more fertile, but it makes the whole pregnancy so much safer. So gestational diabetes and high blood pressure and having 12-pound babies, that's bad for mom and baby. It's higher risk. And so what we're able to do is bring you into normal risk again. And it's so much better for the mom and the baby. I've seen many patients who have come in, younger patients, 20, 21-year-old, 18-year-old, who've come in saying, I've been on diet since I was 8 years old. I am so morbidly obese. I need to do something about my weight. And as long as they have an understanding, again, about the lifestyle modification and behavior changes that they need to change and embrace, they are great candidates for surgery. So the times that we're a little bit more cautious is below 18 years of age. And that's more when people are doing it under research protocols and that type of thing. Those patients have a complete understanding of what they need to do and that they need to do it forever and are ready to do that. Because the most important thing that they can do is get information.